Did you know that almost half of the people of the world live in this region of the Earth, known as the tropics? The tropics is home to many dangerous animals and natural disasters, from snakes and crocodiles to tsunamis and floods. What's the most dangerous thing you can think of? What if I told you that one of the most dangerous things is several thousand times smaller than your little toe? It's a germ called Burkholderia pseudomallei that causes the disease Melioidosis. It can be found just about everywhere in this part of the world and likes to hide in the ground beneath our feet. But when there is lots of rain or flooding, the dirt gets washed away, freeing the germ hiding beneath. When this happens, anyone walking through water or mud can get infected with the germ. The germ can get into your body through cuts in the skin, it can be swallowed, or you can breathe it in. Once the germ is inside your body, it can go anywhere and make you sick in many different ways. You can get a fever, cough, muscle aches, feel really tired, be short of breath, or even get a skin sore that doesn't heal. Most people just get a sudden fever, so you can feel hot, sweaty, or dizzy. If it gets into your lungs, you can be short of breath or have a bad cough. If it gets into your face, then it can make your face swollen. Other times, you don't feel very sick at all and may think you are just having a bad cold. The disease can affect anyone, from the young to the old. So, what makes you more likely to get melioidosis? Well, any long-term diseases like kidney disease, heart disease, lung disease, and diabetes. Did you know that about 1 in 10 adults in the world have diabetes? And the people that get melioidosis the most are those with diabetes. So, if you're diabetic, then you have to take care of your diabetes and continue taking your medicine every day, which keeps you healthy, and those special germ-fighting cells doing their job. Unfortunately, there is no vaccine to stop the melioidosis germs from getting into your body. Once it is in your body, there is also no quick test to say that you definitely have melioidosis. That's why it's very important that you go to the doctor early, because melioidosis can be treated. Once you are treated for melioidosis, you have to keep taking the medicine against the germ for up to 6 months. If you do not keep this up, then the bad germ can stay inside your body and you can get very sick all over again. So remember, to stop you getting melioidosis, wear footwear when walking in the rain or through mud, wear gloves when working outside, wash cuts straight away, and diabetes makes it worse, so take care of your diabetes. If you think you have melioidosis, watch out for a sudden and high fever, cough, feeling short of breath, weakness, muscle aches, non-healing skin sore, and if it's the rainy season, and if you have diabetes, go to the doctor early, because it could be melioidosis.
โรค Melioidosis เป็นโรคที่พบได้ในเขตร้อนทั่วโลกนะครับตั้งแต่ทั้งภูมิภาคเอเชียตะวันออกเฉียงใต้ออสเตรเลียตอนเหนืออินเดียแอฟริกาอเมริกากลางและอเมริกาใต้จากงานวิจัยล่าสุดเราพบว่าโรค Melioidosis น่าจะฆ่าชีวิตคนทั้งโลกประมาณปีละกว่า 90,000 คน
โรคเมลิออยด์เนี่ยเกิดจากเชื้อแบคทีเรียที่อาศัยอยู่ในดินและน้ำเชื้อตัวนี้เนี่ย แอบแฝงอยู่ในดิน รอเวลาที่ฝนตกหรือมีน้ำท่วม แล้วก็มันก็จะขึ้นมาเหนือพื้นดินนะคะแล้วชาวไร่ชาวนาชาวสวนที่ทำงานอยู่เกี่ยวกับในการไถพรวนนะคะก็จะได้รับเชื้อเข้าไปในร่างกายผ่านทางบาดแผลนะคะหรือว่าอาจจะมีการสูดดมเอาฝุ่นละอองซึ่งมีเชื้อนะคะหรือแม้แต่การดื่มน้ำที่มีเชื้อเข้าไป
As for knowing about it before, I was aware that there was something, a soil-borne disease that wasn't very nice, but I had no idea what it was or how you caught it or anything. Now I'm just too aware of it.
ก็เชื้อตัวนี้จริงๆมันก็เข้าสู่ร่างกายใครก็ได้นะคะที่เดินอยู่ในดินเดินย่ำดินที่ไม่ได้มีชุดป้องกันไม่ได้ใส่รองเท้าบูทนะคะเพราะฉะนั้นไม่ใช่แค่เกษตรกรที่จะได้รับเชื้อก็อาจจะเป็นประชาชนคนอื่นๆที่สัมผัสดินนะคะก็จะได้รับเชื้อเข้าไปนะคะแล้วก็ก็คืออย่างที่บอกอะค่ะคนที่ได้รับเชื้อก็จะเป็นโรคนี้แล้วโรคนี้เนี่ยก็มีความรุนแรงนะคะค่อนข้างมากนะคะอาจจะทำให้ผู้ป่วยเสียชีวิตได้
The one I really think it came from was a lesion under my left foot because I was always working in the garden in thongs, feet getting wet, potting mix getting spread over my feet, breathing in potting mix fumes.
It's the sickest that I can ever recall I've been. I thought it was just a touch of the flu coming on. It had that type of feel about it where you just feel achy, breaky, a little bit lethargic. That persisted. Then I went to a stage where it was very achy, breaky, and I just did not want to do anything. Towards before I was admitted into hospital, I didn't even want to eat.
It started off just a general feeling of being unwell, just feeling lousy, sort of a combination of the flu and a bad hangover. From there on, it sort of, you'd get all right for a couple of days and then you'd go down again, and the intervals between got shorter and shorter, and the going down got deeper and deeper, and finally ended up with massive fever and shakes.
I felt probably the worst that you've ever felt. You feel run down, tired.
Initially I thought I just had a sore on my knee that just wasn't going away, and it was an open sore, and it was like that for about 2.5 to 3 weeks, where it was just a little bit of pus and little blood coming out, and just wasn't quite healing.
ผู้ป่วยที่เป็นโรค Melioidosis ส่วนใหญ่จะมาด้วยอาการติดเชื้อในกระแสเลือดซึ่งจะมีอาการไข้สูงช็อกหรืออาจจะมาด้วยอาการปอดบวมปอดอักเสบซึ่งก็จะมีอาการไอหายใจหอบอาจจะมีหรือไม่มีเสมหะให้เห็น2 กลุ่มอาการนี้จะเป็นกลุ่มอาการหลักของผู้ป่วยโรค Melioidosis แต่ก็อาจจะมีผู้ป่วยอื่นๆที่อาจจะมาด้วยฝีตามที่ต่างๆในร่างกายตั้งแต่หัวในสมองในคอในปอดในตับในไตในขาทุกแห่งในร่างกายพบได้หมดนะครับแต่อันนั้นก็จะเป็นส่วนน้อย
And I understand that it probably affects people who have a weaker immune system or have got underlying issues of, for example, type 2 diabetes, heart condition, kidney problems, lung disease. So, and knowing that I'm healthy in that side, I thought I was going to be okay. However, obviously this bacteria doesn't discriminate, so it'll find its way, wherever it can. And I mean that's all I can really say, because at the moment, until you actually get it, I think your fears aren't really you don't really see the fear in it until you actually contract it.
It's one of those things, oh yes, it won't happen to me, and I had no idea how you caught it or what you could do to avoid it or anything, and I certainly know a lot more now.
Well, just that if you do start feeling a bit off and tired, and if you're a bit vulnerable, if you've got diabetes you don't necessarily have to have that, I don't think. As long, if you've got an immune system that's not feeling real good, which mine wasn't, it was sort of down a bit, and you're quite vulnerable on catching it.
Like I said before, it doesn't discriminate whether you can be healthy to some degree, as well as and obviously sick, people with underlying issues. It can be airborne. That was perhaps I think the biggest fear, knowing that people don't feel that you're immune to it. I thought, being healthy and I didn't have any cuts anywhere, I somehow contracted it. And the thing was with me, I didn't even know that I had it. There was no, apart from a small feeling of the lymph nodes, that was it. There was nothing else other than the sore knee. I just thought it was maybe a pimple or a boil that would have just gone away. And if left untreated, possibly could have been very disastrous for me. So in the sense of when it comes to understanding what I know about melioidosis now, is like anything, you treat it with respect, because if you don't look after yourself when you're around and thinking about melioidosis, you're likely to contract it. So and don't ever think it's never going to happen to you, because it can.
Melioidosis, people don't expect they're going to get it or don't think they're going to get it. But it could hit anybody at any time. I thought I was reasonably healthy and fit, but obviously I wasn't. My immune system must have dropped down a bit. And then when I got melioidosis, and then it sort of went downhill from there until I ended up in ICU. I was there for a week.
ปัจจัยเสี่ยงสำคัญอันดับ2คือโรคเบาหวานนะครับเพราะโรคเบาหวานจะทำให้ภูมิคุ้มกันร่างกายอ่อนแอลงแล้วก็ติดเชื้อเข้ามาได้แต่เราก็มีผู้ป่วยที่เป็นชาวนาหลายรายที่ไม่ได้มีโรคเบาหวานแต่เพราะทำนาวันละ8 ชั่วโมงอยู่ในน้ำตลอดเวลาก็ติดเชื้อนี้มาเป็นจำนวนมากครับ
Well, around 1 in 10 adults all over the world affected by type 2 diabetes, and in this situation people who have diabetes are really prone to melioidosis. So that's the problem we have, and that is because what we find is the early immune cells that have to attack the bug is not very functional in diabetic patients, and therefore they are unable to control the infection as they should. So therefore you find that these patients who have type 2 diabetes are very prone to melioidosis, and 40 to 70% of the melioidosis patients around the world have also got type 2 diabetes.
So the melioidosis infection can be quite difficult to diagnose, especially when people come in and they've got like a pneumonia, or they just think they've got the flu, and people will have a look. Sometimes it gets misdiagnosed as maybe having TB or tuberculosis, or just having a chest infection. So unless you have experts here that might think about melioidosis and do the testing for it, but culturing of the bacteria can take up to 7 days, so it's quite a long time from being tested to finding out if you've got melioidosis.
I was diagnosed with melioidosis probably 2 weeks after I went to hospital. They couldn't find anything in the blood test, because I think I left it too long to go to hospital, because I think I'm real tough, and I can deal with it, but in reality I was getting temperatures and that for about 3 nights, and really bad ones.
So it's very important that people with the risk factors for melioidosis or at a higher risk of getting melioidosis and a lot sicker, the diabetes, people on cancer therapy, immunosuppressive therapy and excessive alcohol use, make sure they go see a doctor, especially if they're feeling unwell.
ก็โรคเมลิออยด์นะคะก็มีวิธีป้องกันที่เรารณรงค์อยู่นะคะตอนนี้ใช้อยู่2 อย่างนะคะก็คือให้คนไข้นะคะต้มน้ำก่อนที่จะดื่มนะคะแล้วก็อันที่2เวลาที่จะไปทำกิจวัตรประจำวันที่เกี่ยวกับ ต้องสัมผัสดินและน้ำอะค่ะเราก็จะแนะนำคนไข้ว่าต้องใส่รองเท้าบูทนะคะเพื่อป้องกันโรคมิลลิออยด์ที่มากับดินและน้ำนะคะ
If you can't help yourself and you definitely want to get out there, wear rubber gloves, rubber boots. I can only recommend to people that they do not, and I repeat, do not contract this disease. It's terrible.
Be very careful in wet weather. If you're working in the garden, and especially in the garden in wet weather, that's a bad combination. Wear good shoes on your feet, keep your feet dry. If you're handling soil or potting mix, if you can, wear gloves, wear a respirator. If the potting mix is dusty at all, wear a respirator. Don't take chances because it's better to avoid it than to get it, that's for sure.
The only thing I could say to people is if you feel off, don't wait around to go and get checked out. Go and get a blood test, and especially if you mow grass and play around in the dirt and stuff. It's a bad disease to get.
Look, it's just taking care of your surroundings. Be aware of your surroundings. I mean, if you're going to work in the garden, by all means, that's not going to stop you. But take consideration, like obviously, if it's raining, avoid being in the rain. Maybe wait a day or two for the water to settle down. There's no puddles of water before you get out there and do anything. If you've got cuts, avoid going out there at all. Wait till you heal yourself. Get someone else in to help you. Being airborne as well. So, if you've got underlying issues, with type 2 diabetes or lung disease, avoid going out when it's raining. Even though you've got the cool breezes. As nice as it might be, there's always that risk. And if you're not sure, if anything you're not sure about, if you see any open wounds or if you're coughing or you've got fever, go get yourself checked out. It doesn't hurt. It's at the end of the day, you're doing yourself a favour.